As a parent, it's natural to feel concerned when your child has a fever, and understanding the best approaches for managing it can be crucial. In this video, we will provide you with insights and practical tips on utilizing acetaminophen, also known as Tylenol, and Ibuprofen, also known as Motrin, to bring down your child's temperature. From exploring the causes of your child's fever and assessing its potential risks, to discussing the correct dose, and when to seek medical advice, we're here to empower you with the knowledge you need to navigate fever management with confidence. A child's fever can often be a cause for concern for parents, triggering worries and uncertainties. Understanding what a fever is, why it occurs, and its purpose can help ease anxieties and enable you to provide the best care for your little one. A fever is defined as an elevation in body temperature above the normal range, typically considered to be 100.4 degrees Fahrenheit, or 38 degrees Celsius and above. It is a common physiological response that indicates the body is fighting off an infection or an illness. Fevers can be caused by various factors, including a bacterial or viral infection, immunizations, inflammatory conditions, or even teething in infants. While fevers may be uncomfortable, they actually serve a vital purpose in our body's defense mechanism. When the immune system detects an intruder, such as a virus or bacteria, it releases chemicals that signal the hypothalamus in the brain to raise the body's temperature. This increase in temperature creates an inhospitable environment for the invading microorganisms, as many cannot survive or reproduce under higher temperatures. Additionally, higher body temperatures stimulate the immune system, enhancing its efficiency in fighting off infections. It is important to note that not all fevers require immediate intervention or medical treatment. In fact, mild to moderate fevers are generally considered a healthy response and often resolve on their own as the body's immune system combats the underlying cause. However, it is crucial to monitor your child's symptoms, behavior, and overall well-being during a fever episode. When your child has a fever, it's natural to worry about their well-being. However, it's important to understand that in most cases, a fever itself is not dangerous. Instead, it is a sign that the body's immune system is actively responding to an infection or illness. One common misconception is that a high fever indicates a severe illness. While high fevers can be alarming, they are not necessarily indicative of a more serious condition. The height of the fever alone does not determine the severity of the illness. It is more crucial to pay attention to other accompanying symptoms and your child's overall behavior. Another misconception is that fevers will cause brain damage. Rest assured, this is not true. Fevers caused by common infections do not typically reach temperatures high enough to damage the brain. The body has built-in mechanisms to prevent temperatures from rising to dangerous levels. A febrile seizure is a convulsion that occurs in young children, usually between the ages of 6 months and 5 years. This is believed to be as a result of a sudden spike in body temperature, and not because of the overall height of the fever. These seizures can be alarming for parents to witness, as they involve muscle stiffness, shaking, and loss of consciousness. Febrile seizures are generally brief, lasting for a few seconds to a few minutes, and most children recover without any long-term consequences. While febrile seizures can be frightening, it's important to remember that they are usually harmless and do not indicate underlying brain damage or epilepsy. Fever control refers to the measures taken to reduce or manage a child's elevated body temperature during a fever episode. While fevers are typically a natural and healthy response to an infection, many parents have fever phobia and wonder if they should actively intervene to lower their child's fever. Let's explore this topic further to gain a better understanding. Firstly, it's important to note that fever control is a personal decision that may depend on several factors, including the child's age, overall health, and the severity of their symptoms. Fever itself is not a disease but rather a symptom of an underlying condition. In most cases, the fever will resolve on its own as the body fights off the infection. The primary goal of fever control and fever medicines is to provide comfort to the child, as high temperatures can lead to discomfort, restlessness, and dehydration. Some parents choose to administer fever-reducing medications, such as children's Tylenol, also known as acetaminophen, or children's Motrin, also known as Ibuprofen, to alleviate their child's discomfort. These medications can help lower the body temperature and provide temporary relief. It's worth mentioning that fever control does not necessarily speed up the recovery process or prevent complications. Fever itself is a natural defense mechanism of the body, as higher temperatures can enhance the immune system's response to fight off infections. In fact, some studies suggest that suppressing fevers with medication may prolong the duration of illness, as it interferes with the body's natural healing mechanisms. Ultimately, the decision to control a child's fever should be based on their comfort level and overall well-being. Monitoring the child's behavior, hydration levels, and response to fever-reducing measures is essential. When it comes to taking acetaminophen and ibuprofen together, it is generally considered safe when proper dosing instructions are followed. These medications work differently in the body and have distinct mechanisms of action, meaning that they reduce pain and fever in different ways. Acetaminophen is metabolized by the liver, while ibuprofen is metabolized by the kidneys. Additionally, studies have indicated that taking acetaminophen and ibuprofen together can lead to increased effectiveness. This is known as a synergistic effect. These medications serve as fever reducers and provide pain relief. Ibuprofen, in particular, offers the added benefit of being a potent anti-inflammatory drug, which can help alleviate swelling associated with certain illnesses, such as a sore throat or ear infections. It's important to note that while the combination of acetaminophen and ibuprofen is generally safe, some children may experience adverse effects, such as an upset stomach. As always, it is crucial to follow the recommended dosages for each medication and consult with a healthcare professional or your medical provider to ensure proper usage based on your child's weight and unique needs. Alternating between acetaminophen and ibuprofen for your child's fever or pain management may be considered when a single medication fails to effectively control their symptoms, administering acetaminophen followed by ibuprofen after a specific interval. Introducing the other medication in a staggered manner can potentially enhance its fever-reducing and pain-relieving effects, and has been shown to be better at reducing fever and pain than giving both medications at the same time, thereby improving overall symptom management. To begin, it is generally safe to give both medications together every 6 hours, following the correct dosage instructions provided on the bottle, and not exceeding the maximum dose in a 24-hour period or individual dose. Alternatively, you can alternate between them, which has been proven to be most beneficial. Acetaminophen is typically given 4 times per day, with 4 to 6 hours between doses, whereas ibuprofen is typically given 3 times per day with 6 to 8 hours between doses. Precise dosage is crucial for safe usage. Carefully check the recommended dose for your child's age and weight, as both medications can have adverse effects when used at higher doses. If you have any doubts or concerns, it is always advisable to consult your child's doctor. To prevent any mix-ups, keep a written log of the medications given, including the dosage and timing. This will help you keep track of which medication was administered and when, reducing the risk of accidental overdose and serious side effects. While fever medication can be an effective way to reduce a child's fever, there are also non-medical approaches that parents can consider to help alleviate discomfort and restore normal body temperature. Here are some non-medical ways that may help reduce a child's fever. Adequate fluid intake. Encouraging your child to drink plenty of fluids, such as water or clear fluids like diluted fruit juice. Dressing in lightweight clothing. Dressing your child in lightweight, breathable clothing can promote heat dissipation and make them more comfortable. Avoid bundling them up in heavy layers, as this may prevent heat release. Room temperature control. Maintaining a comfortable room temperature can help regulate your child's body temperature. Cool compresses. Applying cool, damp washcloths to your child's forehead, wrists, and ankles, can provide some relief by aiding in heat loss. Ensure the compress is not too cold to avoid discomfort or overcooling. Rest in comfort. Ensure your child gets enough rest to aid their recovery. Provide a comfortable environment with soft bedding and a calm atmosphere to promote relaxation. While acetaminophen and ibuprofen are commonly used to manage fever and pain in children, it's essential to be aware of the potential side effects and risks associated with their use. Understanding these aspects will help you make informed decisions and ensure the well-being of your child. Here are some important considerations regarding the side effects and risks of acetaminophen and ibuprofen. Acetaminophen side effects. These may include nausea, vomiting, a rash, or allergic reactions. Liver damage can occur if the medication is taken in high doses or used for an extended period. Ibuprofen side effects. Common ones include stomach pain, heartburn, and diarrhea. In rare cases, more serious side effects such as allergic reactions, kidney problems, or stomach bleeding may occur. Drug interactions. Both acetaminophen and ibuprofen can interact with other medications. It's important to inform your healthcare provider about all the medications your child is taking, including prescription, over-the-counter, and herbal supplements, to avoid potential interactions or complications.